Hello, everyone. Thanks so much for joining me with Cameron Carter, who's the Manager of Supplemental Benefits, who oversees strategic partnerships and supports product innovation for Bright Health Plan. Cameron, thank you so much for joining us today. Tell our audience a little bit about Bright Health and who you serve.
Absolutely. So thank you for having me, Solomon. I really appreciate the opportunity to share both about Bright Health as well as what we're doing to address COVID-19 and some of the services for our members. Bright Health is a diversified healthcare company. Our main business is our health insurance vertical, which covers Medicare Advantage beneficiaries and individuals on the federal and state exchange. We currently cover members across 12 states. Most recently closed our acquisition of Brand New Day, a Medicare Advantage health plan out of California that will be entering that state in 2021. So that's Bright Health.
Awesome. Yeah, I feel like I see something in the news about your rapid growth all the time. So very exciting.
Thank you.
Yeah, of course. Please tell our audience a little bit about how coronavirus has impacted how you deliver care.
Absolutely. For Bright, I mean, like a lot of the carriers, we were doing our best to show up for our members. We took a position to reduce barriers to accessing care. That was our priority number one as it relates to what we were trying to do for our consumers throughout every single one of the states I mentioned earlier. In addition to pulling forward solutions to address disparities in access to care, specifically we made changes such as allowing prescription refills to be done earlier, expanding our transportation benefit, including waiving ride limitations to and from the network facilities and pharmacies. And then last was covering all telehealth visits in connection with doctor-ordered COVID-19 testing and diagnosis at no cost to our members. So for us, it wasn't just about providing more services and solutions, but thinking through the financial impact that a lot of our consumers would be exposed to due to what's going on when it comes to COVID-19 in their states.
Awesome. That's great. And I know when we first talked, just getting all of this together so rapidly was, planning to do things over the course of months versus weeks. And can you tell our audience a little bit about what it was like standing up telehealth for behavioral health in particular so quickly?
I would say it was challenging but fulfilling. Many of us came to Bright Health to be a part of a consumer-centric health plan, and this initiative was a testament to that. We didn't have a national telehealth offering, in all of our markets. So to this point, the point I made earlier, we recognized the opportunity that COVID presented us to really show up for our consumers. Initially, the objective was to really think about increasing access to medical care while reducing unnecessary urgent care and ED utilization. So with that, as we saw telehealth as an opportunity to really be a tool for our consumers, we felt that, not only have it in a couple markets, but every market at once is really the best thing for us. In addition to that, we recognize the need to go beyond medical care and to appreciate connecting mental and physical health and making a point to ensure members have parity in their ability to access that care. So for us, we looked at the opportunity to partner with someone in the marketplace to deliver this solution to our members as quickly as possible with the highest quality of care. We actually started the implementation the first week of March. And we thought of it in the notion that it would take about 3 to 4 months on average for a net new solution to be put into the market. But due to operational focus, due to technology focus, we're able to do that in under 4 weeks. So we actually did it in 21 days. So we started the implementation on March 9th. It was actually live in every single one of our markets, which was about 25 markets across 13 states on April 6th. So we actually started seeing care as soon as that actually happened. And we're both excited, but also just taken back by the ability to actually show up for these consumers and actually do something that we've all wanted to do since we've been at Bright, which is to extend the definition of what a health plan can be and really be someone who actually does more than what maybe someone would expect. So it was tough, but it was exciting. It was exciting to see it and actually see it now as a manager.
Mm-hmm. That's great. So you mentioned working with a partner. Can you talk about what that process was like and how you ended up selecting a partner to tackle this issue together?
Absolutely. So we chose Doctors on Demand. We had a good relationship with some of their individuals in the marketplace as it relates to who they felt was the best to really do this. And our due diligence really demonstrated that not only were they able to provide the technology infrastructure, the operational infrastructure, but also the network, in particular behavioral health network, because that's one of the things that we want to be thoughtful of, which is the whole body of care. So when we looked at Doctors on Demand and said, is this something they can do? Is this something they can really work with us on? We created a custom project plan. So again, going from 4 months to 3 weeks is definitely a tall ask, but when you have a great partnership with someone like that, the creativity just, kind of came out. And I think it's really important that you have the right partnerships in the market to show up for these members, but also to deliver quality care as consistently as possible.
Hmm. That's great. Well, in your role overseeing strategic partnerships, I know we've talked about social determinants in the past, and
Mhm.
it'd be exciting to learn a little bit more about what you've done to date, or exciting partnerships that you think our audience would be keen to learn about.
Yeah, so for us, we look at the ability to create a partnership less on maybe the cachet or maybe sort of like what our competitors are doing, and think of it in the way of how do we solve problems for our consumers and help them to actually do self betterment. So we look at things like food insecurity. It's not just food insecurity, before they go into the hospital, but thinking about it post discharge. Being one of the first plans in the ACA to actually offer a post discharge home delivered meal program. These are things that we sort of think about as a way of saying, hey, how do we extend the definition of what a carrier can be for our consumers? Additionally, with transportation, as we mentioned earlier, not just having it in market, but actually being able to configure in a way to actually do more for the members. So, this is allowing members to not only go to in-network facilities, but also pharmacists, also dentists, things like that. So it's really going above what the actual definition is for some of these benefits. Then additionally, thinking about it in a localized way. So, like I mentioned before, being in 12 states, we don't want to treat New York like we would treat Colorado. And being thoughtful on within Colorado, how does Summit County up in the mountains, fare versus Denver? So things like that are how we think about the user experience at a very detailed level as we solve and address social determinants of health for some of our members across our multiple lines of businesses.
Mhm. Neat, interesting. Um, well, standing all of this up so quickly is just remarkable. What would you say has led to your success, not only with this, but just the amazing growth with Bright lately?
It's a really good question, Salome. I would say it's a steadfast commitment to consumers. We knew from the beginning how important, for instance, this project was. We knew we were doing something bigger than ourselves, the team and the company, and the intrinsic value from this work manifests in a way that really was inspiring, but demonstrates Bright's focus. Again, like I mentioned before, showing up for our members as best as we can consistently. The growth is a testament to both our leadership, both our investors who've actually believed in Bright, but also the newcomers we have on the company who say, you know what, I'm buying into your culture. I'm buying into your commitment and your strategy. And that's been seen across the different states we've been in. So, I've been at Bright now 3 years. When I first started, we were just in one market, just in Denver, Colorado, back in 2017, offering ACA plans. So to see where Bright is right now is fascinating. To recognize we're in an ability to actually go into, our 13th or 14th state within 3 years is, it's hard to believe, but I'm glad that I'm here to be a part of it. And it's been a great ride thus far.
Hmm. That's great. So, it's not always glitter and roses and rainbows. So, what was most challenging about the last month or month and a half that you've prepared all of this telehealth so quickly?
Yeah, for us, it was one of the things where we committed to this initiative, early March. We felt like, what our goal is to make sure we can get this in the market, within 3 to 4 weeks, like, I mentioned before. But in the middle of implementation, Bright had to close all of our offices, and my colleagues could move fully to a work from home setting during this rapid implementation. So you can imagine going through claims processing, eligibility files, or some of the more technical things, but also from the clinical components, the marketing components, while having to transition from what was known as the office to what it is now, which is a lot of us working from home, like myself. Um, but appreciating that transition, I was able to see many of my teammates leveraging the Bright values and their ability to both empathize and really kind of do their part for members. So it's not just about the technology, but how do we do things for communication? How do we think about, working with these providers in this new network to make sure they understand who Bright is? In addition to e-prescriptions and making sure people know how to actually do those things when they actually finish their telehealth visit. So all those things were aware to us, but the challenge in particular was going from face-to-face meetings to now virtual Zoom, and there's 15 people on the call, and how do you navigate that? But the challenge is something that I would say now we're pros at almost, going through our 8th or 9th week right now during quarantine, but it's a challenge I think a lot of us, relish in and really kind of learned a lot from. So I'm grateful for it.
Hmm. So, speaking of going digital and working remotely, and what do you think Bright will continue from all of this? Are there certain practices that you think that were implemented just for this unique time that you actually think the organization might keep and move forward?
Really good question. I would say, so it goes in two approaches. When we first looked at telehealth, for COVID, we say, we want to make sure we address the ability to increase access to care. We want to really be thoughtful about reducing unnecessary ER usage, and then making sure we actually address mental health as it pertains to access, and making sure people had not just, psychologists, also psychiatrists. Now as we kind of shift more towards more of an access strategy focus, it's still making sure that platform's in place, still making sure members have an understanding of how to utilize it, but more importantly, thinking through iterative changes. So more services onto that platform, additional improvements to the member and provider experience. One note that was actually something we've seen thus far is 40% of the claims that we've got thus far for our telehealth platform in the last month and a half have been first-time users of a mental health provider or network. So it's one of those things you're starting to see a change in consumer behavior that is really kind of pulling forward the need for virtual care, the need for different modalities, but also the need for different communication, right? Because for someone who's never gone to, let's say, a therapist, never seen a psychiatrist, doesn't know, a psychologist, how do you sort of like define that for a consumer so they know the right direction of care to go to? So for us, as we think about sort of the 2.0, if you will, of our telehealth strategy over the next, I would say 6 months, 6 to 12 months, it's really being more granular about how we actually deliver the information to consumers. How do we deliver the values that consumers consist in the marketplace? And then being really mindful of the fact that this is a tough time. This is really a tough time for a lot of individuals. They're sort of really trying to navigate both the insurance side, but also how they find care. So moving forward, we're just going to continue to double down on the member experience, double down on deep interviews, look to our brokers, look to our sales team, and say, hey, look, what are you hearing in the marketplace? What are providers telling you? And being able to actually then commercialize that information is how we think about 2.0, 3.0 moving forward on our access strategy, where telehealth is a point solution for us, along with transportation and some of these other things I mentioned previously.
Yep, that's great. Speaking of members now, there are a lot of really exciting digital behavioral health tools, a lot of digital health tools out there that could be used by health plans for members. But do you think that there are any barriers still that are prohibiting members from adopting a lot of these tools?
Yeah, I would say, there's the destigmatization of a lot of these tools and solutions, and other people can understand that this is for me. I think that's the first one. The front door to care that people discuss a lot of times on the digital side isn't the narrative that members don't know how to use the smartphone, don't know how to use the web solution. It's just recognizing that this is for me. And I think that's the first bucket of really thinking through chat function and video capability and some of these different components that allow members to know, is there an easier way to onboard myself into this tool? I think subsequently thinking through retention, going back to what we've seen thus far in the claims process, a lot of those members that we see have their first visit through our partnership with Doctors Demand, have their second visit within a week of that first visit. So we're starting to see this slow consumer change over time. So it's being thoughtful of not just creating that stickiness, but creating that stickiness that ensures the member knows that this is for me, like I mentioned before. So when I think about a lot of the tools we see in the marketplace, we've evaluated specific to digital behavioral health. It's thinking through beyond the first visit, beyond the second visit, how do I ensure the member is getting the quality of care they need for the 7th, the 8th, the 9th visit? Whether it's making sure the member can actually see the same provider through that digital communication, making sure the members know they can actually go directly to that same case manager as they think through how to navigate their daily living. So some of those different contingencies of care is how we think about that as we get beyond just the adoption. Because for us, we see those as sort of the two big roadblocks that impede an individual's ability to see the most amount of value when you think about a digital behavioral tool.
That makes a lot of sense. And again, given the fact that you are managing a lot of the partnerships at Bright, we've got a lot of startups in the audience too. Do you have any advice for them, whether with Bright or not? Just how do they navigate? How can they develop relationships with health plans? And what would you tell them to if they wanted to create some kind of a partnership with a health plan like Bright?
So I'll do my best to make this a Bright focus one. So I don't want to speak for the other carriers on the network and things like that. But I would say the one thing is start with the problem you're solving. Like, just be honest. One thing we want to be thoughtful of is actually being able to frame out, you say, digital behavioral health. Is this adolescent? Is this adult? Is this senior? Like, being very prescriptive on just that line item of, we do this. So I understand very contextually, this is a problem that I know I have. This is a problem that I don't think we have, or is this a problem that I haven't even thought about yet? What I don't want to do is, in my opinion, over assume, if you will, what you're doing because I've heard a different story from somebody else. So when you're very particular and very prescriptive on that problem you're solving, that starts the conversation very quick for me to say, okay, this is a problem I don't have yet. Is this coming soon? Is this coming in 6 months? Is this coming next year? And that at least procures my interest to say, let's start this conversation as dialogue. I think additionally, patience. A lot of us plans are really thinking through what is our digital transformation strategy right now, during COVID, right? I think previously, a lot of plans are sort of on the fence about, what does a digital behavioral health strategy look like in lieu of physical in-network and brick and mortars. So now as we start to kind of come through and really think about what does that experience look like, we're interested in those conversations. This is a great time to be discussing what's coming into the marketplace. This is a great time to really think through additional use cases for your tools. So if it is something that serves adolescents, how do we think about young adults? And for young adults, how do you think about young professionals? We sort of think through additional consumer segments that for someone like us as a plan who offers care to individuals who are newborns up to, I think our oldest member is 97. We see the full range of consumer needs and, being able to say, hey, we have something for this consumer group. Have you thought about it? That's something I'm interested in learning about. So I would say that's the first thing. Starting with that problem, then thinking through specifically how do you create additional incremental value to different consumer segments with your tool and your solution over time.
Mm-hmm. Yeah, that's great advice. Now, more broadly, not specifically for digital behavioral health startups, but
Mm-hmm.
you've created a lot of interesting partnerships for, like you said, food security, transportation, and it seems like a lot of the innovators in this space, they want to partner with someone like you, but
Mm-hmm.
they don't have any kind of mechanism to get reimbursed for their solution. Is there anything you can comment on that front and anything that Bright's doing differently?
That's a really good question, and it's a really good, I would say, pain point to the partnership vertical for a variety of carriers I've spoken to as well, and something we've been very thoughtful and meaningful, or something we've really thought through. Um, I would say the easiest, the quickest question, quickest answer to that is having a multitude of cost structures. We hear value-based care, we hear fee-for-service, but then thinking through collectively, what is the best way we can exchange and have a transactional relationship related to paying for the service, paying for this value? Is it sort of a cost share? Is it some type of other approach altogether? But for us, the partnerships we have a multitude of cost structures. We've looked at it from the standpoint of we have floating capitations, we have traditional capitations, but it's being able to be very flexible and coming to the table with that flexibility. What we don't want to do is assume that, again, this is going to be one type of way with one type of payment structure. So being able to say, hey, we've thought through a multitude of them. We want to get your opinion on them. That allows me to say, I can fit this into my plan benefit if it's done in this cost structure. I can fit this into my rewards program if it's done in this way. And being able to allow us and provide more contextual understanding of these different ways of being reimbursed and being paid from jump, along with that problem you're solving, the consumer segment you're trying to work on, that allows us, and particularly, Bright Health, to really then think through, is this something for us in a year, something for us in 6 months, or something we need to be on right now? And that's something we're really being mindful of. So to those out there who are interested in talking to Bright Health, definitely when you come to the table, you reach out, just be thoughtful in that as we think through not just a partnership, but sort of a multi-year approach over time.
Awesome. That's great. Thanks so much, Cameron. I think that's really great advice for all stakeholders in the audience, but
Mm-hmm.
especially the startups. So thank you for all of this great advice, and so
For
excited
sure.
to know more. Excited that we could have you here today, and looking forward to having you connect with our audience. Please comment any questions that you might have, and thanks everyone for joining us.
Thank you.